Today we're going to be discussing the nursing assistant. A nursing assistant is an individual who helps nurses with basic care. They help with bathing, grooming, elimination, bed making, and other needs. Nursing assistants are also referred to as nurse aides. Before the 1980s, training for nursing assistants was not required by law. Nurses would provide on-the-job training. Some hospitals, nursing centers, and schools offered courses. Team nursing was common. A team leader, which was a registered nurse, assigned care to nurses and nursing assistants based on each patient's needs and condition and the skills of the staff. Primary nursing emerged in the 1980s. This is when registered nurses plan and give care. At this time, many hospitals only hired registered nurses, and nursing centers hired nursing assistants to provide resident care. Home care increased during the 1980s. To reduce cost, hospital stays were shorter. Discharged hospital patients often needed home care. Nurse Practice Acts define registered nurse and licensed practical nurse scope of practice. That is the activities that a licensed individual is permitted to perform. Congress makes federal laws for all 50 states to follow. State legislators make state laws. It is important for nursing assistants to know both state and federal laws. Each state has a Nurse Practice Act. The Nurse Practice Acts also describe nurse education and licensing requirements. They are in place to protect the public from persons practicing without a nursing license, and they are enforced by State Board of Nursings. The Board of Nursing can deny, revoke, or suspend a nurse's license with the intent of protecting the public. So that can occur if somebody is convicted of a crime in any state, selling or distributing drugs, using a person's drugs for oneself, grossly negligent nursing practice, being convicted of elder or child abuse, demonstrating incompetent behaviors, or if a nurse or CNA makes a medical diagnosis. Some Nurse Practice Acts regulate nursing assistant roles, function, education, and certification. If a CNA does something beyond his or her role, he or she could be practicing without a license. So as we said on the prior slide, scope of practice is the legal limits of a person's role. Licensed nurses supervise CNAs. CNAs are able to perform nursing tasks within their scope of practice. State laws differ. It is the CNA's responsibility to know their scope of practice. OBRA is a federal law that applies to all 50 states. Each state must have a nursing assistant training and evaluation program. A nursing assistant must successfully complete the program to work in an agency that receives Medicare funds. Areas of study in a nursing assistant training program include communication, infection control, safety and emergency procedures, resident rights, basic nursing skills, personal care, transferring, positioning, range of motion, signs and symptoms of common diseases, and caring for the cognitively impaired person. OBRA states that nurse assistant training programs must provide at least 75 hours of instruction, at least 16 hours of supervised practice, and include a competency evaluation. A competency evaluation is a written test and a skills test. The written test is multiple choice. The number of questions varies by state. For the skills test, the CNA candidate performs certain skills that he or she learned in their training program. OBRA allows at least 3 attempts to successfully complete the evaluation. Certification is the official recognition by a state that standards or requirements have been met. After successfully completing the nursing assistant training and competency evaluation program, an individual can use the title used in your state. Some examples are CNA, Certified Nurse Aide, LNA, Licensed Nursing Assistant, RNA, Registered Nurse Aide, SRNA, State Registered Nurse Aide, or STNA, State Tested Nurse Aide. OBRA requires agencies to provide 12 hours of education to nursing assistants every year. Performance reviews are also required. If a CNA has not worked for 24 months or longer, a new competency evaluation and/or retraining can be required, depending on the state. The Nursing Assistant Registry is also required by OBRA. It is the official record or listing of persons who have successfully completed the state's nursing assistant training and competency evaluation program. It must have at least the following information about each nursing assistant: full name, identifying information, date competency evaluation was passed, information about findings of abuse, neglect, or misappropriation. Any healthcare agency can access this registry information. CNAs are able to access their own information. Individuals are removed from the Nursing Assistant Registry if they have not worked in the last 24 months. For an individual to work in another state, he or she must meet the state's Nursing Assistant Training and Competency Evaluation Program requirements. This can be done by applying for endorsement, either reciprocity or equivalency. When an individual applies for endorsement, a state recognizes the certification, license, or registration that was issued by another state. A job description is a document that describes what the agency expects the employee to do. It also states the educational requirements for a job. It's important to note that CNAs should not perform tasks that are not included in their job description.